I am from Tijuana, so I'm being here in Tijuana. But I did med school here in Tijuana, Mexico. Then I went to Sonora, that's a town near here to Baja California. It's about 10 hours from here. And I did general surgery. After general surgery, I did transplant surgery. So I'm also a transplant surgeon, kidney transplant surgeon. And after that, I did bariatric surgery. So I believe I have a lot of experience doing this, and and I love what I do. I believe bariatric surgery can improve a lot of things in the quality of life of our patients. So I love what I do. Thank you for being here in the webinar. If you have any questions, feel free to ask, okay? So here in the company, we can do all the bariatric procedures. We can do all the bariatric surgeries and all the bariatric endoscopy procedures, all the revisional procedures. So I believe Mexico Bariatric, it's the most important weight loss company here in Mexico. I'm so glad to be part of this. So we're going to start talking about the gastric sleeve surgery. The gastric sleeve surgery, it's a restrictive surgery, and the surgery, it's only in the stomach. We can do surgery in the stomach and also in the small bowel. In the gastric sleeve, the surgery is only in the stomach. So we do everything laparoscopy. It's a minimally invasive surgery, and the recovery time is really, really short. In the gastric sleeve, we remove the 80 or the 85% of the stomach. So this is a really, really restriction surgery. The part of the stomach that we remove produce the hunger hormones, the ghrelin hormones. So all the patients will be feel fullness earlier, and they will not feel hunger in the first 6 months. So this is gonna improve or make the diet more easy. So I love this surgery. I believe this is the surgery the surgery the most popular surgery at this moment because it's having a lot of great results. Why only 6 months is the hunger reduced? Because other part of the body produce the ghrelin. The brain and the pancreas can produce the ghrelin hormone. So that's why the first 6 months is when we have the most benefits of the ghrelin hormone, when we reduce the ghrelin hormone. More questions? So we can, the results of the gastric sleeve surgery, we can have the, we can lose the 65 or 70% of the excessive weight in the first year. So this is a real cool example of what you can get with the gastric sleeve surgery. Every patient is different, but this is a real common explanation about how many pounds you can lose with that gastric sleeve. Let me check the questions.
So we are going to answer the questions at the end. Is that what you're looking for?
Yes. Okay. At the end.
Yeah. We'll just continue and let me know if you need different slides. But
okay.
We would just answer everybody at the end.
Okay. So the gastric bypass. The surgery, it's in the stomach, but also in the small bowel. This is It's a different surgery, more powerful surgery, because this is a restrictive surgery and also a malabsorptive surgery. So it works in different ways, in the stomach and in small bowel. So in this surgery, we can have more weight loss. We can expect to lose the 70 or 75% of the excessive weight loss in the first year, but also it can have more long-term weight loss results with the gastric bypass. I really like this surgery because patients can have uh, in the gastric sleeve, patients can have more nausea. In the bypass, there's no nausea in the gastric bypass, so patients are more asymptomatic. So can I have the next, please, Ron? Well, this is what are we doing now to prevent COVID infections? At this moment, the pandemic show us a lot of things, and sanitizing is the most important part. All the personnel of the hospital, all the surgeons, all the team in Mexico Bariatric Center, we are using all the infection controls that are indicated for hospital and weight loss surgery. So at this moment, we don't have patients infected with COVID-19. So that's really, really important. I worked in a hospital with COVID patients, so I bring all the information to prevent our patients, so you will be face safe in our hospital. So